The PulsioFlex monitor is a modular monitoring platform for evaluating the hemodynamic volume status of critically ill patients. PulsioFlex comes with ProAQT technology integrated, which is mainly used in the operating room either for high-risk procedures or in high-risk patients. With a dedicated module, PulsioFlex can be upgraded with the PiCCO technology, which is mainly used in the ICU setting. ProAQT is best applicable for use in complex procedures with a high risk of intra- and post-op complications, anticipated high blood loss of more than 20%, and volume shifts during the procedure which can result in hypo or hypervolemia, and long surgery time of more than 120 minutes. The dedicated ProAQT sensor is a high-resolution pressure transducer which can be connected preoperatively to any arterial line. In real time, beat by beat, ProAQT can analyze the pulse contour and derive essential hemodynamic trend parameters. For example, flow-related parameters such as cardiac index, afterload parameters such as systemic vascular resistance index, and volume responsiveness parameters such as stroke volume variation and pulse pressure variation. These continuously updated parameters enable the physician to detect the fluid responsiveness of his patient perioperatively and implement the concept of goal-directed fluid therapy, which can reduce postoperative complications in abdominal surgery by more than 20%. Furthermore, goal-directed therapy can reduce hospital length of stay by more than a day. By applying the PiCCO module to the PulsioFlex, it is possible to use transpulmonary thermodilution as a calibration technology. This technology allows the conversion of hemodynamic trend parameters into precise and accurate values. Moreover, PiCCO adds valuable parameters into the available spectrum. In order to use PiCCO, a dedicated catheter is needed, which can be inserted into the brachial, axillary, or femoral artery. In addition, a standard central venous catheter is required. For the transpulmonary thermodilution, pre-cooled saline is injected into the central venous catheter. The temperature and the starting time are recognized by the PulsioFlex monitor. The indicator passes the right heart, the lungs, the left heart, and finally the PiCCO catheter, which allows, because of an integrated sensor, a specific temperature curve to be recorded. From this temperature curve, very precise parameters can be derived as cardiac output, global end diastolic volume, and extravascular lung water. With more than 1,000 publications since 1997 and more than 140,000 applications per year in more than 60 countries, PiCCO is a clinically proven and widely accepted less invasive alternative to the highly invasive pulmonary artery catheter. It is mainly used in the intensive care unit when you want to answer the following questions. What is the current cardiovascular situation? What is the cardiac preload and afterload? Is the patient fluid responsive? And is the patient developing lung edema? Within the context of goal-directed therapy, PiCCO can help to reduce complications and length of ICU stay in cardiac surgery patients, as well as in other ICU patients. PulsioFlex with PiCCO and ProAQT, monitoring at its highest level.